And they're areas where an organisation like AGITG, which is interested in public good clinical research, regardless of what it costs, with no intention that it necessarily benefit any particular sector of the business community, just our community in general and patients. And so that's why they're there. Some of them are opportunities that we think we have particular skills or capacity in that are internationally competitive, that we should support and promote and encourage. And others are like registry-based trials, or where we might have access to something that won't make anybody any money, but could tell us something about whether we're applying the outcomes of our research in the community in the best possible way, for example. And patient-reported outcomes is all about whether we can properly evaluate the patients that have treatments and determine that they're getting the value from the treatment they're getting that would have been expected or that was predicted to occur as a consequence of the clinical trial.
A lot of these priorities have come about through our consumer advisory panel telling us, look, this is what my colleagues, my connections want to know about. This is what the Australian community wants AGI to do trials in. So some of them, for example, with the nutrition, I'm very proud that in the Upper GI Working Party, which I chair, we have introduced nutritionists as members of our committee. And every trial I ask them, can you think of a nutritional endpoint here? Have you got a sub-study that you can think of that we can add to this trial? And they often do, and we're trying to put those sub-studies in. And I think that's just so important, and we haven't really done that in the past. So we really need to do that. We need to engage our allied health colleagues within our hospitals and really get them involved in our trials as well. And that's been a wonderful innovation, I think. The other things that we have done in that sphere is that we are involving more and more people who are expert in measuring quality of life and in measuring patient-reported outcomes in our team so that we can do that properly, because quite frankly, a lot of us, that's not our skill. Our skill has come much more from, basic clinical research and trials research, and we haven't got a lot of expertise. So we're bringing in the expertise. Come and join our meetings. Please contribute to our trial design and the way in which we collect data, and that has also been really, really useful. And these days, if you publish a trial, you must have quality of life data, patient-reported outcomes. Otherwise, the trial is useless, because unless it makes a difference to people, quite frankly, there's no point doing it.